some random girl, but it won't be. Okay. Alright. Work. Okay. Shoot. Okay. Knock, knock, knock. Hello, I'm Kelly. I'm going to be your student nurse today. Do you have any pain or allergies that I should be aware of?
No.
Okay. I'm going to wash my hands, provide privacy like I did. And then can you tell me your name and date of birth?
Alyssa Clark, 3497.
Okay. Okay. Now I'm going to ask you some questions. Can you tell me where you are?
Detroit Mercy.
And do you know what year it is?
2017.
And do you know why you're here?
For school.
Okay. The patient is ANO times 4. The patient looks their stated age. There are no signs of illness. Their mood and affect is appropriate for the situation, and their speech is clear. And the patient looks well groomed and has good hygiene. Okay, first I'm going to inspect the head. There are no lesions, bumps, or scars that I can see. It is warm to touch, and the color is normal for ethnicity. Now, I'm going to inspect the eyes. All right, just follow my light. Woo!
Great.
That was great. And just follow it all the way through. Okay. Perla is intact. The pupils are equal, round, reactive to light, and they accommodate. The sclera is white, and can you pull down? And the conjunctiva is pink and moist. Okay, now I'm gonna do your mouth. Can you open up? The oral mucosa is pink. Can you smile? And open your mouth. Okay, all teeth are intact and white. Can you do this? Show me your gums. The gums are pink and moist. There's no inflammation. Can you stick out your tongue for me? The tongue is pink and moist. There is no coating. And can you stick it out and say ah? The uvula rises to the midline, and there are no tonsils present. Okay, now can you smile for me? And blow up your cheeks, and close your eyes, and where am I touching?
My left cheek.
Okay, cranial nerve 5 and 7 are intact, and the face is symmetrical. The eyes are also symmetrical, and there's no drooping. Okay, I'm going to move to the neck. The trachea is at the midline. I'm gonna palpate the carotid arteries. They're both 2+ bilaterally. I'm going to listen with my stethoscope, with the bell. All right. Hold your breath. Okay, and then hold your breath again. Okay, there were no signs of bruise, and I heard nothing. Now I'm going to move to your arms. Okay, the skin is warm to touch. The color is appropriate for the ethnicity, and there are no lesions, bumps, bruises. Now I'm going to do your brachial pulses. 2+ bilaterally, and your radial pulses. 2+ bilaterally, and now I'm going to have you squeeze my fingers. All right, strength is equal bilaterally, and I'm going to put your hands. Capillary refills within 2 to 3 seconds, and can you put your nails up like this? And there is no clubbing. Okay. Now we're going to listen to your heart and name the landmarks. Okay. This is the second intercostal space, right sternal border, aortic. Second intercostal space, left sternal border, pulmonic. Third intercostal space, left sternal border, herbs. fourth intercostal space, left sternal border, tricuspid. Fifth intercostal space, midclavicular, mitral, and I hold it here for 1 minute to listen for the apical pulse. Okay, and now I'm flipping to the bell to listen all the way back up. Okay, S1 was heard better at the apex and S2 was heard better at the base. And the rhythm was regular and equal. Now, I am going to listen to your lungs. Every time I place it, just take a breath. Okay? Side. This side. Okay, and if you could just spin around so we could do the posterior. Okay, lung sounds were clear and there were no signs of adventitious lung sounds. All right, now I'm gonna test for CVA tenderness, so let me know if you feel anything.
Okay. No. No.
Okay, and now I'm gonna look at the alignment of your spine, if you could just lean forward. Okay, the spine is straight, there are no signs of scoliosis. And if you could just face my way. All right, now I'm gonna look at the anterior transverse ratio. It's a 2-to-1 ratio. Now I'm going to have you lay down. Okay, I'm going to inspect. There are no signs of bruises, bumps, or lesions. It's warm to touch, and the contour is flat, and the color is normal for ethnicity. Now I'm just going to listen to all 4 quadrants. All vowel sounds are present and normal active. Okay, now I'm gonna palpate for tenderness and let me know if you feel anything, and then I'm going to name 2 organs in each quadrant. So we have the right lower quadrant, which consists of the right ovary and the appendix. The right upper quadrant is the liver and gallbladder. The left upper quadrant is the spleen and stomach, and the left lower quadrant is the left ovary and descending colon. Any tenderness?
No.
Okay, and now I'm going to check for JVD distension, which there is none present. I'm going to have you sit up, and there is no JVD distension either. Okay, now I'm going to sit up and we're going to do your lower extremities.
Really small.
Okay. Table's falling apart. The legs are warm to touch bilaterally. The color is normal for ethnicity. And there's no bumps, lesions, or bruises bilaterally. Now I'm going to check for edema. There is no edema bilaterally, and I'm going to find your PO pulse. 2+ bilaterally in your posterior tibial. 2+ bilaterally. Now I'm going to have you push your feet up and push them down. All right. The strength is equal bilaterally. And now I'm going to have you scoot forward. And I'm just going to have you stand up. Okay, she passed the get up and go test. It's effortless. Are you dizzy?
No.
No signs of dizziness, and she was very steady. Now I'm just going to have you, I'm going to assess your gait, so if you could just take a couple steps this way and then turn around, walk this way. Okay. The patient's gait is steady, effortless, and rhythmic. And if you could just stand together and put your arms to your side, close your eyes, and we're going to do the Romberg test. Wait 30 seconds, and the Romberg test is negative. That's it.